Hi, my name is Russell and welcome to this product introduction video for the Laerdal Advanced Airway Solution. Regardless of your role, this video will give you a really good understanding of what the solution is, why we developed it, who it's for, and the key features that it has. When it comes to emergency airway management, particularly management of a contaminated airway, EMS and ER clinicians face limited training opportunities with high quality, clinically accurate training tools that represent the real-world challenges and complications that patients present. By offering a training solution which addresses these challenges, the Laerdal Advanced Airway Solution will help to improve provider confidence and preparedness in these areas, ultimately leading to improved individual and team time-critical skills and better quality of care, all part of Laerdal's goal to help save 1 million more lives every year by 2030. The solution is a fully equipped training platform designed for contaminated, basic, and difficult airway management and CPR practice. When we take a look inside the transportable suitcase, first we see waterproof training mat for use during contaminated airway training. On this side of the suitcase, we first see 2 pouches with accessories, and the first of 2 Laerdal Advanced Airway mannequins. Underneath this one, we have the Laerdal suction unit with a modified reusable training canister for contaminated airway training. And then on the other side of the suitcase, 2 more pouches with accessories, and the second advanced airway mannequin. You'll see that both of them have a stiff neck select in place. Underneath this mannequin are 4 containers, 2 for each of the mannequins, which can be filled up to provide weight to each mannequin during training. The Laerdal Advanced Airway Solution has a comprehensive feature set. So let's dive into the details, break it down by focusing our attention on the star of the show, Laerdal Advanced Airway Mannequin. Those familiar with Laerdal will recognize the basic form here and be aware of the QCPR feedback that it's provided, all of which remains, but we have added a lot to that basic platform. To start, we have a medium difficulty realistic airway, which can be adjusted to exhibit laryngospasm, pharyngeal swelling, and tongue edema. The mannequins offer head tilt, chin lift, jaw thrust, but we've also added trismus and stiff neck. Chest compressions and chest rise as normal, but the introduction of a bifurcated lung means that dynamic left-right lung resistance can be seen with asymmetrical chest rise. On top of all of that, we have perhaps the most exciting functionality, which is a contaminated airway, which offers visual indication of lung aspiration. All of these features can be layered on top of one another to offer progressively more advanced learning. So let's dive in with a bit more detail and look at each feature specifically. So here we have one of the Laerdal Advanced Airway mannequins. Pharyngeal swelling, tongue edema, and laryngospasm are each independently controlled by their own pulse bulb and valve release system, which is connected here at the base of the mannequin. First, pharyngeal swelling. As I squeeze this pulse bulb, the airway is constricted, and I squeeze the release valve, it's released. Next, tongue edema. And release. And finally, laryngospasm. You will note that each of these features has their own indicator bulb here at the base of the mannequin. This is so that the instructor can be aware of which features are engaged. So as I squeeze the laryngospasm bulb now, you can see here that the indicator is inflated and released. This is especially useful if you have multiple features engaged at the same time. For example, tongue edema and laryngospasm. And release. Bringing our attention to the head, you can see head tilt, chin lift, and jaw thrust. And just so it's a bit easier for you to see, I'll remove the face skin. And if you keep your attention here on the jaw, you can see that lower jaw engage and close as I rotate the adjustment wheel and release. Similar for stiff neck, we have rotation now, and when the feature is engaged, that motion is severely limited and returned. These two blue sliders at the base of the mannequin are used to independently restrict airflow to each side of the bifurcated lung. So, as my colleague will show, in the open position, we'll see symmetrical chest rise. And then as I close one off, for example, this side, the patient's right, we should now see asymmetrical chest rise. And vice versa. If I switch them now, open the right and close the patient's left. And open again. We'll show the contaminated airway function on this second mannequin. The solution comes with a system which allows vomit to be pumped into the airway by an instructor or peer, whilst the learner practices their suction technique. And let's show you now. The innovative modification to Laerdal suction unit's reusable training canister means that the vomit is effectively in a closed-loop system. This means that multiple learners can practice their suction technique without the time-consuming and messy reprocessing and cleanup between each learner. You might have noticed that these aspiration canisters here filled with a little bit of vomit. Now, that is a visual representation that the lungs were aspirated. This is a particularly high risk in an unconscious patient with a contaminated airway. And as I said, these canisters are a great training aid because they give visual indication that the suction technique could perhaps have been better. Having such realistic simulation with real fluids, of course, does require some cleanup. So the system comes with an adapter which allows warm soapy water to be pumped from the canister with the same pumping system back through the internals of the mannequin, allowing the internal tubing and the airway itself to be completely flushed through of any vomit and residue. So that brings us to the end of the video. I hope you now feel more familiar with the solution, its capabilities, and the positive impact that it can have on training quality and patient outcomes. Thank you.